Good evening, guys. Welcome to my channel, itKENbeyouradventures. I'm Kenneth, and welcome back to my channel. And this time, I'm gonna do an ambush vlog with my best friend Vaughn, and he's now cooking. So we're gonna go downstairs, and we're gonna discuss a very hot topic this time in my vlog. Let's go downstairs and surprise him. This will be a vlog with so much random questions all about coronavirus. Hello, welcome to my channel. This is an ambush vlog. So what are you cooking? So what are we cooking for today? Yes, of course. You think we're not thinking of any content? We've got content for today.
So welcome to my kitchen. I'm cooking a pork binagoongan.
So guys, earlier, as I told you, I was upstairs and I just wanted to surprise him with a very good vlog this time because we're thinking of content for my vlog, and you know, this is actually the best time to do an ambush vlog with him because, you know, we've never got the time actually to like make a content today. So this is probably the best one because this is very spontaneous, and what we're gonna talk about today is all about why? No, it's not weird. No, it's not weird. This is a surprise, that's why. It's all about no, but because this is like a surprise vlog, so good thing that
Why are you so happy about coronavirus?
No, it's not about being happy, but should we be sad about things? No.
Before anything else, I'm messing up with my coconut milk here. This is just a common Filipino dish. But anyway, we should not be worried.
I'd say yeah. I would agree.
We should not be worried, but we should be worried. Actually. Because they said that the government here in the UK is doing something, but we cannot feel it in the hospitals. So I think there are common notions that the government is doing something and they're waiting for a full blast of this coronavirus, but
we're talking about UK, okay? So we're not talking about any other countries, alright?
We're talking about UK.
Okay, our setup actually is in the UK, so because other countries have got different policies in terms of how they're managing the corona outbreak this time. So this is probably the biggest epidemic, no, not epidemic, but the biggest pandemic. Yeah, biggest pandemic of the century. So, or I would say like century, not decade, but yeah, century. Because like before there was like avian flu, there's SARS, there's meningococcinia, but it's much worse than all of those outbreaks because I think coronavirus is actually probably the most serious of all of those outbreaks that happened in the last couple of years in the world. So anything to say, any views?
This is weird. You're just flexing your new iPhone, yeah?
No, I'm not flexing my new iPhone. No.
You're just flexing your
But
new iPhone.
you know, this vlog is very, although it is spontaneous, but I believe that, you know, we just wanted to like inform the public and give some light with some of our perspective in terms of coronavirus outbreak here in the UK. So where should we start? Anyway, so there's actually like a lot of cases now all over the world, and you know, the numbers of people affected with coronavirus is actually rising. It's never, you know, it's actually like the start of everything. It's never like I don't know when it's gonna end, and I don't know if they're gonna find a cure for this one, but at the moment the only thing that they could only do is really to find some preventive solutions on how to like really contain the cases of people affected with the coronavirus, and probably some preventive actions or preventive measures in order for us to like really control and lessen the cases, ongoing cases that's been rising. Here in the UK, I don't know how much already are the cases in the UK. Any chance,
I'm not sure, but it's already 1,566.
1,500.
Joke.
No, let's just
sure.
check because you've
I'm
got
not
your
sure.
you've got your phone, so check how
What
much.
I
cases
know
there are.
at the moment is we are banned in the US, banned in 1,140. See, I'm
Wow.
close.
So
40 COVID positive in the UK.
wow. What do you think are the measures of the government? I've heard there's like a loads of hearsay about this herd immunity that's going on circling around social media community. So can you give them some light about this herd immunity? Boss,
What?
can you give them some light about herd immunity?
Well, it's just more of like their experiment. I think I don't know if it's an experiment or it's based on a scientific research that the more immune and the more exposed a human being to a virus is, the more the antibodies is developed, and the more people is exposed, the more the community can be more immune. So that's why we called herd, because people is gonna be in a group infection, and thus the community will be immune against the virus. But I do not know if they're aiming if 60% of the UK population.
More than a half, I guess.
So that's really crazy, because what if, because at the very moment there is no cure about this coronavirus thing. So if the 60% would go downtrend, what will happen to the 40%? And who are these 40%?
Frontliners.
Are these the other vulnerable patients? So we are not really sure what are the Brits and the leaders has been talking about this.
Yeah, exactly. This like to add up as well. This herd immunity, we're not so sure if this is gonna be implemented, or is this the mode of action that the government is taking, because there's no travel bans here in the UK. Classes are still ongoing. People are still working. They're still going to concerts. They're still going to public places. They're still having some gatherings around here. But other countries have already, imposed travel bans. They already closed their borders, and a lot of other preventive measures in order to contain the cases. But here in the UK, I don't think that the UK government is. I'm not so sure where everything is going actually. But we can only guess at this time. But for those people out there, the best thing that we can do is really to do something and to be responsible for ourselves, not to spread infection if possible, and also to isolate ourselves if ever, quarantine ourselves, I would say. But it all starts with really be responsible about yourself. Wash hands, simple things like washing hands. When you're in public places, avoid crowds, and make sure that whenever you touch something or anything in public, make sure that you disinfect yourself. But the problem now is the scarcity of resources. We can't buy any toilet paper, we can't buy any alcohol gels, we can't buy any rubbing alcohol. So I don't know. To be honest, it's becoming more of a serious problem here in the UK as well. Same as to go with other countries. So it's like a worldwide phenomenon. So it's not like only enclosed to like one country, but a lot of other countries as well are like having so much problems.
The thing is, as nurses, we experience it firsthand here in the UK. We've experienced having persons under investigation, or patients under monitoring for COVID, or we've even encountered some positive cases. But the thing is, what was the government doing? Like, if the government hasn't been providing us with equipped trainings like in China. They haven't provided us any gears.
Yeah. Are we ready? Are we ready
Yeah.
if something happens like really serious?
Like,
That's the question there.
at the moment, we are not really
We are not
ready
ready.
at the moment. The FFP mask,
Will not even gonna protect
and
you,
The N95 mask. There's only a limited number of surgical
Visors as well as
There's
like
nothing-
gowns.
There's no any other trainings or any preparations provided, especially in the private sectors. And even in the NHS, we have so many friends in the NHS working, but they have been so worried that the government or the hospital administrations has been so lax. Even the infection prevention committees has been so lax, or if not that lax in a negative connotation, but they have not been doing any drastic change to policies to prevent further this infection. So we're still waiting for our Prime Minister to do, because even our health minister
has been infected with coronavirus together with her mother. So, be honest, it can be anyone. It doesn't discount anyone. So there's a big possibility for everyone to be infected with this virus if you're not so careful. And also the biggest the biggest challenge here is that there's a lot of cases that turns out to be positive in a lot of different hospitals. So we're not really ready. So there are some cases that you wouldn't expect, that some patients would come to your hospital with just like simple cough, simple sore throat, and then they turn out to be like positive, and people are exposed. They are not diagnosed early. They are not tested early on the early hours when they were just admitted. So it turned out to be that after a few days, they turned out to be positive. And what about all those days that, a lot of people were already in contact with them? So, it posed so much risk to a lot of people. Not so much probably for the young population, but more so for the vulnerable people, because they are the ones who are really more or most affected with this phenomenon. Because, when you have when you have like a really good immune system, the possibility of you experiencing the complications brought about by coronavirus is really low. Whereas when someone is infected, like when they're vulnerable, like when they have like cancer or comorbidities like other underlying conditions, they are more susceptible to experiencing the severe complications brought about by coronavirus. So that's the only thing, my only concern is not really for myself, but for myself if ever I infect others. Because that's really the problem. And I'm not so sure actually, how this coronavirus, if it's like evolving, is it mutating, or they're like new strains. And I hope that in the coming days or in the coming weeks that we could find a solution to this problem, this looming problem, because it's getting very, very serious, because other countries rising like almost the same as Italy. Very, very soon the UK, if they're not gonna be imposing strict rules or preventive measures, we could end up everything out of hand already, and it's probably gonna be too late for us to really manage this one. So I'm not so sure about this herd immunity, if it's gonna be imposed or if this is the way that the government is going to. But for me, it's not really like the best solution for this because considering the vulnerable population. And yeah, and if ever guys, if ever you feel like you got like flu-like symptoms, always call the hotline. We've got like a hotline here in the UK. Call 111 and then inform them about your condition, about your situation, and do not be afraid or do not impose a fear to a lot of people that when you've got this signs and symptoms, you're just gonna keep it to yourself. You have to like really inform, be educated, and also to help others as well, not to infect others with this one. It's better that we prevent this rather than, prevention is better than cure. So it's best that we really subject ourselves for testing, because that's one of main point of everything. We have to like really prevent and get everyone educated about this coronavirus.
Maybe my final word for this is, aside from being educated, is don't let yourself be driven by your anxiety, because sometimes other people are so anxious about this, and their activities of normal living is interrupted and disrupted. So just take precautions, be mindful of your body. You know your body, you can feel your body, and yeah, just spread the
just spread what? The good news.
Not the virus, but spread the proper knowledge about the pathogenesis, or the pathogenesis.
No, but actually
the nature of the virus,
disease, yeah.
or the illness.
Exactly. There's a lot of things to learn about coronavirus at this time. It's too early yet, because there's still ongoing researches about solutions, about vaccines, medications, preventive measures on how we can combat this coronavirus. But I know there's an end to everything. Even seasons change, even the flowers wither, even the leaves wither. Wow. So yeah, there's always an end to everything. It's never gonna be forever. For sure, in the coming days or in the coming weeks, we will always find a solution to this problem. But as of this time, the best weapon that we can have is to educate ourselves, be tested if you feel like you have flu-like symptoms, and also simple measures like really washing hands, as I said, and really be educated about this. And also, also get yourself be updated with the news of what's going on outside, so that you're educated, you're well aware of what's happening around you. And yeah, that's really my final thoughts about coronavirus. So what's going on with our...
So we're done with the cooking. We're ready for dinner. But anyway, thank you for listening, and I hope you spread the knowledge about the proper prevention and the exposure as well of this illness. So be safe, everyone.
And thank you so much. Be safe, everyone. So thank you so much for this.
Don't forget to subscribe.
Don't forget to subscribe to my channel, itKENbeyouradventures. So thank you so much for listening to us. Hopefully that you get something from us, like really sensible things and sensible stuff. I know that this is like a spontaneous vlog. So thank you so much, guys. So once again, thank you so much and good night.